This is a portrait of a man whose ideas once echoed across classrooms, podcasts, lecture halls, and the internet. Dr. Jordan Peterson. A clinical psychologist, author, and former professor, he became widely known for speaking about meaning, responsibility, and the necessity of confronting suffering, rather than avoiding it. For years, he helped millions articulate their confusion about chaos and order in modern life. Yet, as his influence expanded, his personal life reportedly entered periods of intense strain, illness, and withdrawal from public view. This is not just a story of fame or controversy, but of the fragile balance between intellectual conviction and human limitation, and what happens when a person's philosophy is tested by life itself. A childhood shaped by books and cold landscapes. Jordan Peterson was born in Edmonton, Alberta, Canada, in 1962, and raised in the small town of Fairview. It was a place defined by long winters, quiet streets, and the kind of isolation that encourages introspection. His father worked as a schoolteacher, and his mother served as a librarian, placing books at the center of his early environment. That early exposure to literature became foundational. In a world where entertainment and distraction were limited, reading became both refuge and discipline. Even as a child, he was drawn not just to stories, but to the deeper questions behind them. Why people suffer, how societies collapse, and what holds human beings together when everything else falls apart. Early intellectual awakening and ideological searching. As a teenager, Peterson encountered literature that challenged simplistic views of politics and morality. Writers such as Orwell, Huxley, and Solzhenitsyn exposed him to themes of ideology, control, and human cruelty. These works reportedly unsettled his early political assumptions and pushed him to question whether systems alone could solve human problems. He briefly explored political activism, but eventually stepped away, feeling that surface-level ideology could not explain deeper psychological realities. Instead, he became interested in why individuals and societies repeatedly drift toward destructive patterns despite good intentions. This question would become central to his intellectual identity and later academic work. Academic path toward psychology and human behavior. Peterson began his formal higher education at the University of Alberta, initially studying political science before completing a second degree in psychology. This shift reflected his growing belief that human behavior, rather than political systems alone, held the key to understanding social order and chaos. He later pursued doctoral studies at McGill University, focusing on aggression and addiction under leading researchers in the field. His academic work examined how personality traits and environmental factors contribute to destructive behaviors such as substance abuse. By the time he completed his doctorate in clinical psychology, he had developed a framework centered on the psychological roots of human suffering. Harvard years and academic recognition. In the 1990s, Peterson joined Harvard University as a faculty member and researcher. There, he studied personality psychology, belief systems, and the biological and environmental influences on behavior. He also taught students who later described his lectures as deeply transformative, emphasizing the real-world consequences of ideas rather than abstract theory alone. His academic presence was serious and disciplined rather than performative or public-facing at that stage. Though not yet a global figure, he was building a reputation as a rigorous thinker who bridged psychology and philosophy, focusing on how individuals construct meaning in the face of uncertainty and adversity. Return to Canada and clinical work. After his time at Harvard, Peterson returned to Canada and joined the University of Toronto. Alongside his academic responsibilities, he maintained a clinical practice, working with individuals struggling with addiction, depression, and trauma. This direct engagement with patients reinforced many of his theoretical ideas about responsibility and personal transformation. He observed recurring patterns in human suffering, avoidance, denial, and the rejection of personal accountability. These clinical experiences deeply influenced his later public lectures and writings, where he increasingly emphasized the importance of structure, discipline, and confronting painful realities rather than escaping them. Rise to public attention and cultural debate. Over time, Peterson's lectures and interviews began reaching a much larger audience beyond academia. His discussions about meaning, order, responsibility, and psychological resilience resonated widely, especially online. He became a polarizing figure, praised by some as a voice of clarity in a chaotic cultural moment, and criticized by others who disagreed with his interpretations of politics and society. Despite the controversy, his influence expanded rapidly through lectures, books, and public appearances. He authored one of the most widely discussed self-help and philosophy-influenced books of the 21st century, further solidifying his place in global cultural discourse. Health struggles and withdrawal from public life, reported accounts. In later years, Peterson's life reportedly became marked by significant health challenges and periods of withdrawal from public engagement. Accounts from family and public statements suggested episodes of severe medical distress, hospital treatment, and long recovery periods. These struggles were compounded by previous stressors, including family illness and personal medical complications. Some narratives also describe environmental and physical stress factors, contributing to his decline in well-being. During these periods, his public presence became sporadic, leading many followers to notice a sudden silence from a figure who had once been highly visible and outspoken. Reflection on meaning, suffering, and fragility. Peterson's public philosophy often centered on the idea that meaning is not something given, but something constructed through responsibility and confrontation with suffering. Yet his later life, as described in public accounts, became a stark reminder of the limits of intellectual frameworks when confronted with bodily fragility and uncontrollable circumstances. The tension between philosophical order and live disorder became part of the broader narrative surrounding him. His story, as many interpreted it, raised a difficult question: what happens when the principles that guide a person's life are tested by realities they cannot fully control or resolve? Conclusion: the life of Jordan Peterson continues to be interpreted in many ways by supporters, critics, and observers, trying to make sense of his influence and struggles. Beyond public debate, his story reflects a universal human tension between belief and vulnerability, structure and collapse, meaning and uncertainty. Whether viewed through the lens of psychology, culture, or personal narrative, it remains a reminder that no philosophy is immune to life's unpredictability. In the end, the question his life raises is not only about ideas, but about endurance, what it truly means to keep going when certainty disappears and only experience remains.